record, right? Is there a red button? Just kidding.
Is there?
Yeah.
I can't see a red button.
Yeah.
You can see it?
Yep, top right.
Go glasses.
Do what you love what you do, 'cause love will return to you. Never give up, stay the fight, wear that hat with pride. You only need 3 things to succeed. A lot of try, a lot of heart, and guts.
Hey everybody, Mike Burkholder, Contra Costa Today. I have Debbie Toth with me of Choice in Aging, and I have to ask you about that name because there really isn't a choice in aging. We just kind of do it.
Well, we don't have a choice whether or not we age. We have a choice about how we age.
That's a good way to put it.
Yeah.
So I'm going to do something because
Oh my gosh.
you got to plug Ecolab.
No, we don't have to
Okay.
plug them. We just use their great mug for my coffee in the morning.
So are they your husband's company?
My husband works for Ecolab, yeah.
So anyway, we're here to talk about you and aging and all that good stuff. Can you give us a little plug about what you guys do?
Sure. So Choice in Aging is a nonprofit organization that's been serving Contra Costa County and broader area in the Bay Area since 1949. And we originally started as a polio rehab facility, but really in the 70s, the shift to serving the aging population took place and a new industry formed that was called adult day healthcare. So looking at how instead of having people in institutions, we have them in community-based settings during the day. And so we had the 16th licensed adult day healthcare facility in the state of California. We started that in Pleasant Hill.
Wow.
And in the 90s, we started providing at the Bedford Center, which is in Antioch, an adult day healthcare program there. And then we increased our services to the aging population in 2008 and 2009 by providing some social work and nursing complex case management, as well as deinstitutionalization. So we're getting people who have been living for a long time in skilled nursing facilities, busting them out and bringing them back into the community.
And so, you mentioned the Bedford Center. How vital has that been out in East County to be able to do that and get, the elderly active and engaged again and interacting?
That's a great question. So the Bedford Center is the only licensed adult day health center serving all of East Contra Costa County. So it is a vital service. And basically, adult day healthcare services aging population that have multiple chronic conditions and they otherwise might go into an institutions, or their caregivers are going to be at home caregiving for them. Instead, they come to us for a day to have fun. So it looks like a senior center. If you walk in, people are doing activities. They might be reading, they might be singing, they might be playing bingo, doing art, whatever. They're engaging in activities, but there's a nurse who's administering medications, who's checking blood pressures, who's checking weights, who's liaising with the physician to find out, are we doing the right things, and this medication doesn't seem to be working, can we tweak it? And we also have social workers, and we also have physical therapy, occupational therapy. So there's a lot of stuff that's going on behind the scenes that people don't see, but they come in, they have fun, and what happens by the end of the day is that they're tired, they've had a great day with their friends and hanging out, and they go home and they go to sleep. And instead of going into an institution where they cannot choose what time they eat, what time they bathe, what activities they attend, or who sleeps next to them.
So it's like a kid's daycare then.
Well, we try and distance ourselves from kids because we want to ensure that everybody maintains dignity. But to the extent that, yes, they come, they're cared for, somebody is providing them the services that they need to remain vibrant, happy, healthy, and out of institutions, yeah.
So you kind of said a lot of interesting things there in terms of engaging and activities. These are obviously elderly people. What does that do to their mind, just being able to go back to doing that again, and whereas before they're kind of sequestered in a assisted living facility and maybe don't get the engagement they need?
Yeah, so it first of all, it brings joy to people
Sure.
to be able to do something. And in addition to that, keeping the mind engaged and active prevents the onset of dementia and other things that can happen. So there's a lot of positive outcomes from just engaging the brain. But to be in a congregate setting with other people who are going through similar things has its other kind of magic to it, so that you don't feel like you're alone. And there's this really cool dynamic. So once you and I are coming every day, and then I don't come because I'm depressed one day, and then I come the next day and you say, where were you? How come you didn't come? I was here yesterday. So there's like this implicit peer pressure that's a positive peer pressure
Sure.
that makes me want to get up in the morning and come. Where before, when I was isolated and alone, I had no will, nothing to look forward to, you know, so it creates this community.
And so, what does it cost to run something like that?
So that's a really loaded question.
Totally
So,
loaded.
Totally loaded question.
But you're volunteer
So-
based. You have grants, obviously.
So we're a
donations.
nonprofit. So we're a fundraising machine. We do grant writing. We have annual fundraising events. We have end of year campaigns. We now participate in Giving Tuesday. There's a whole bunch of things that we do to collect money, and we use volunteers. Not just because it offsets some of the cost, because you can't replace our staffing with a volunteer. That's
Sure.
We are a licensed
You need
healthcare
professionals.
facility, right? So, but it's not our same faces every day. The participants don't have to see our mugs every day. They have somebody coming in and doing horticultural therapy. They have somebody coming in and doing music. They have different people coming in and adding to that. But the biggest issue that we have is that we are a benefit that people who are on Medi-cal or Medicaid can receive if they qualify based on their physical chronic conditions. But what the Medi-cal dollar pays for our services, $76.27 per person per day, costs us more than $100 per person per day to provide. So we have a couple $100,000 gap to fill every year providing this program. So
Is that for your program overall or just Bedford Center?
that's the Bedford Center.
Okay.
The Bedford Center. So in Contra Costa County, the benefit is a Medi-cal managed care benefit. And Medi-cal, some people don't know the difference between Medi-cal and Medicare. And people say, oh, I've got it all. No, you don't. If you're 65 or
called
older,
insurance.
yeah, that's called hopeful thinking. So Medicare people who, when they turn 65, they have access to Medicare. Medicare has a series of benefits that have to do with primary care, hospital care, medication. It does not provide for long-term care. It does not provide for long-term skilled nursing placement. It does not provide for adult day health care or other care that people need as they age. Medi-cal, on the other hand, is you qualify if you're extremely low income or you have some other qualifying condition that allows you to qualify for it. But people are extremely low income who are on Medi-cal, and Medi-cal has the long-term benefit. So Medi-cal pays for this benefit, but Medi-cal doesn't pay what it costs to
Sure.
provide the service. We have had this same reimbursement rate for 10 years. I can tell you my workers' comp goes up every year, my health insurance cost goes up every year. We cover all of our employees with health insurance. The maximum that an employee pays on a monthly basis for their health insurance is $100 if they're employed with Choice in Aging. So we have a commitment to our employees, so we have to do all that fundraising. We have a commitment to our participants. We're not going to stop providing the services, but we need to get paid a little more for sure, and that's why you see me sometimes spouting off
Pushy?
about
Pushy?
pushing,
Just a little.
pushing just a little.
Just a lot. Just a
Because
lot.
we have this problem, right? So we don't pay what it costs to keep people out of skilled nursing facilities, but taxpayers, so this is taxpayer dollars, right? Taxpayers are paying less than what it costs to provide adult day health care, but they're paying $6,000 a month to have that person in a skilled nursing facility. If you're looking at the two, do you want to live in the community, go to a day program, have friends, go home at night and get to sleep in your own bed and do your own thing? Or do you want to be in an institution at 5 times the cost and have no ability to make any decisions? We're not exactly thinking properly through how we need to address this. And part of the bigger problem is that we have a massively growing aging demographic. So if we're not spending money wisely now and don't have the infrastructure to care for them in the community, they're either going to go into institutions, into hospitals, or become homeless.
And so, you talk about infrastructure. In East County, Bedford Center is really the only one that you guys are doing. Is there any others, or is it just essentially East County needs to start from scratch and really make an investment towards that type of service?
Well, East County has started from scratch to be making investment in that kind of services, and I think it's coming from community-based organizations, because I believe there are some programs beginning in East County, one in Brentwood. I couldn't tell you the name of it, but they're daycare.
You don't want to give a plug?
I don't know the name. Otherwise, I would happily give them a plug, because this is some misnomer that if somebody else is providing the same service that we're providing, that they're a competitor. They're not. I'm going to walk you through something really quickly. In Contra Costa County, over the next 40 years, according to the California Department of Finance, people who are 65 to 74, that age cohort, is going to grow by 125%. 75 to 84 years old is going to grow by 198%. People who are 85 and older are going to grow by 299%. I don't have competitors. I'm begging for others to come into this market, because no matter how many pop up, there are never going to be enough to service the need. So no, they're not competitors. If I knew their name, I would give it to you. But the idea is, there have to be these things that pop up, and there are a couple that are coming in, but it's very expensive to start a day program. And if you're a social day model, meaning you don't have the healthcare staff, you don't have the nurse, the social work, the occupational therapist, all that stuff that we have, if you don't have all of that, you don't get Medi-cal dollars. It's all private pay. So people have to be able to afford to pay for that service.
Sure.
So there are complexities no matter what you're doing, and we actually should be figuring out a way to funnel money into community-based services, because they're far less costly than institutionalization, hospitalization, and homelessness.
And that's what I love about you. You're passionate about the subject, and no one's a competitor. You're all working together, and it's for the greater good. And that's what I appreciate about you. It's always about the mission, not the pat on the back.
Thank you. Yeah, no, I appreciate that, though. Our mission is to keep people, to promote the dignity and independence of people with disabilities and special needs. And we really looked at how we achieve that goal with the programs that we provide, because it is really hard to say that you're promoting independence when you can't ensure that somebody has a roof over their head.
Sure.
So one of the things we're looking to do as an organization is to level and rebuild and create a new model called an Aging in Place campus, where we have independent housing that's not just accessible, because we use that term, we kind of throw that term around, accessible housing. Accessible for somebody using a wheelchair, but is it accessible for somebody who's aging and may have dementia? Mm-hmm. So we want to think about all of those design principles when creating a place and a space in the community where folks can age with wraparound services like adult day health care, case management, transportation, nutrition, all on one campus. And the cost to do that will be less than the cost to put people in skilled nursing facilities, because we as an organization don't just want to serve a small finite number of people. We want to figure out how we better serve this aging demographic with dignity.
Got it. One thing I'm curious about is the lack of services out in East County. How do you bring more out here money-wise? Is it working with the county, just more grants, more public support? I mean, do you build it and then they come, or do they come and then you hope to fill it?
Well, they're here. They're here, and they're in need. So I think, I am not sure the history of why we haven't invested in East Contra Costa the way that we have in other areas of the community, but certainly there is such a blossoming aging, I mean, the east part of the county has the largest growing aging population, and the east part of the county has the least amount of public dollars invested in it.
Sure.
I think that's beginning to change. I think some partnerships with John Muir, where they're working with Meals on Wheels Senior Outreach Services, for example, to bring
That's a great program.
some services out to East Contra Costa County. I think that there was a study done in 2014 by the county that looked at the dollars and how they went to nonprofit organizations and service in each part of the county. And once that report elevated the discrepancy between how money is allocated in the county, I think that sparked the interest of some foundations, some funders, some hospitals, health plans. So I think there's an awareness. That's always like the first step, right? Is like, you know you have a problem, right? Not that I've been through Alcoholics Anonymous or anything 5 times, just kidding. But the first step is recognizing there's a problem. So it was documented, it was studied, there's a problem, and so now there's an awareness, and so now there starts to be some money coming in. So we had a problem. I had a funder approach us some years ago and said, will you provide a support group to caregivers, caregiving for people with Alzheimer's disease here in East Contra Costa? And I said, that would be a really difficult thing to do because there aren't any resources. So one of the things we do in a caregiver support group is say, here are all the resources you can use. I can't say that in the same way in East Contra Costa that I could say that in Central Contra Costa.
So it's a different packet.
Or West Contra Costa. It's that you have to have the services out there to refer people to, and it's sort of like there's not a lot of options for transportation. How do you get to Bedford Center if you live in Brentwood and you've got to take Tri-Delta paratransit and there's 10 people that you're going to stop and pick up along the way and it's a 2-hour trip, because think about the morning traffic, and that's somebody who's got dementia and chronic, all kinds of other chronic conditions and incontinent and can't sit on a bus for 2 hours.
Sure.
Like, so it's really hard to say you're going to be able to come to adult day health care, but you're not, because it's not really feasible, because we don't have an adequate support system to get people to and from there. And we don't have an adequate system to pay the transit provider to provide more trips, because they can only charge twice what their fixed route cost is, but it costs them over $30 per trip. Like, there are some really intricate, broken things in the system. So I can't figure out how we solve it all, except to say that thankfully the awareness is there. Some funders and some health systems are interested in spending money. I think our supervisor, both of our supervisors that cover this area, Supervisor Burgis and Supervisor Glover, are both very interested in seeing more money coming to this part of the county. And so hopefully they'll be able to figure out how we can do the private-public partnerships to get more services out here. And as a matter of fact, we did start providing a caregiver support group last year.
Nice.
Because we're starting to see this funding come in, because senior Meals on Wheels Senior Outreach Services is out here, because John Muir is investing in this community. For all those reasons, we feel like there's more resources and support that we can provide.
So you mentioned transportation, and that's maybe the biggest issue. Is that kind of the main issue, or is there a bunch of others that really should be addressed?
In terms of resources?
Just resources available and need?
Well, so we want to have more day programs, right? We definitely need to have more day programs. So somebody shouldn't have to travel 2 hours to get to a therapeutic day program, right? It sort of defeats the purpose of therapeutic. So yes, transportation is one of, I would say, the top 3 barriers to people being able to live independently. You also need to have adequate support systems in place, somebody to care for you, to help you eat, walk, ambulate, all of that stuff. And our county is heavily, heavily impacted. And if you're not on Medicaid, then you don't have the money to pay for those services. So that's a huge deal. Transportation, providing that support around your activities of daily living and instrumental activities of daily living. Those are the ambulating, eating, walking, being able to pay your bills, all of these things that allow us to live on a day-to-day basis. And housing. So if people lose their housing, they're not going to be able to age independently in the community. So the biggest thing too when you're talking about the Alzheimer's population is the caregivers are completely burned out. They need to have respite. They need to have education. They need to have tools to learn to care for them. So there's a whole host of things that people need to have, but if you can't get from A to B, you're not going to get any of those things. So transportation really is a huge issue.
So how does one get into the program you offer? Is it kind of like, do you guys outreach for it, or do they call you, or how does that work?
That's a great question. So when you are a nonprofit that loses hundreds of thousands of dollars a year by just opening your doors, it makes it very difficult to have a marketing budget, right? So I think if we had one commercial on CNN at 6 o'clock for 3 weeks, we'd be busting at the seams, right? But it's hard to get your word out. So we attend health fairs. As you know, I'm pretty active in the community and make sure that I show up in places and talk about what we do. We get referrals through the Contra Costa Health Plan. We get referrals through hospitals, discharge planners, the county information and assistance line, word of mouth. And we try to be at as many health fairs and senior fairs and a presence in the senior centers so that folks know that we're part of this continuum.
So you're basically recruiting.
Yeah.
Kind of.
Yeah.
Easy way to say it.
Yeah, and where we can, but it's like a patchwork of that. It's not like you have this big budget where you can just go and, do brochures in every place and space. It's a lot of sort of community navigation.
It's hard work.
Yeah, yeah.
So how did you get into this?
That's a loaded question, but when I was in high school, I got a job. I grew up in Southern California, and I got a job at the Motion Picture and Television Fund Hospital. And it had a hospital, a clinic, independent living, assisted living, skilled nursing, and an Alzheimer's. So it was all levels of care were there, in addition to having this clinic on site. And I worked in the independent living dining room. I had 80 extra grandparents. It was like the greatest experience in my life.
How was birthdays?
Birthdays? So I just fell in love with all these people. Well, Christmas was great. But so I fell in love with the aging population, so much so that when I went to UC Irvine, I was still coming home on the weekends and working there, and still coming home every summer and working there. So I worked there for 7 years. Not a lot of people who are graduating college can say that they worked 7 years at one job at that point in their life. But I so loved them. And then life happened. I went and studied abroad in Hungary. I met a husband. I did this, that, and the other. And fast forward to 9/11. And I spent a lot of days in front of my TV watching just this horror unfold and this realization that life is fleeting. Any moment, anybody can just poof, be gone. And I asked myself, if I were to die today, would I be happy with where I am? And I was doing financial services at that time. And I thought, no, I'm missing my oldies. And so I went in search of a job where I could work with the aging population. And also, when I was working at that motion picture fund, I went to a skilled nursing facility for the first time in my life, and I was just devastated. These people that I love, these 80 grandparents that I love, could end up in a place that smells of urine, and people can scream and not get any attention. And I mean, what I saw in there horrified me. And so here I am, post 9/11. I go on Craigslist. I find this job that's available working in adult day healthcare, whatever that is. Like, I didn't even know what adult day healthcare was. So I went to the job interview on Pleasant Hill at Mount Diablo Center, and the woman said, do you know what adult day healthcare is? And mind you, this was not in the day of Google, right? So I couldn't just Google it and look it up. And I said, actually, no, I don't. I was actually attracted to this job posting because it said working with the aging population. And she said, well, our whole goal in adult day healthcare is to keep people out of institutions. And I said, you are going to hire me. And that was 16 years ago.
And here you are.
And here I am.
Perfect.
Yeah.
I think what you've done in the last 17 years with trying to grow this program and work with the elderly is very just amazing, that you would, number one, give up a lot of opportunity in other areas financially to go into this. But I think one of the things that I think you could take away is you're with the elderly who have lived life. They've provided a lot of experiences. I'm sure you've, thousands of stories. What was the biggest takeaway for you of just kind of learning from their experience? What's some of the best advice you've gotten?
I love that question. So, and I love how you built that, because that is something that I think our society has just abandoned, is the understanding that you can only get wisdom and life experience through living. Mm-hmm. And that means that you're now aging. And our society just discards the aging population. They're a second thought, afterthought, or not a thought. And it's really disappointing and saddening. So thank you. I totally agree. And I oftentimes rely on stories of life that I've learned from the people that I'm serving that helped me navigate life. And I can tell you one really profound experience I had when I was 18 years old. I was working at the Motion Picture and Television Fund retirement home, and I had one of the residents there, Manny, was a traveling salesman, and he was 92 years old, and he was very quiet, and he didn't talk to anybody, but on my break he would play checkers with me. And we would sit silently and play checkers and not talk. Years, not talk. And then one day he says, all right, I trust you. We've hung out long enough.
2 years.
I want to share with you, in my 92 years of life, what the most important life lesson is. And I said, what's that? And he said, never regret anything. And I thought, that's ridiculous. I regret waking up sometimes because I want to sleep an extra hour. I regret saying that stupid thing that came out of my mouth. Or, so I remember thinking at the time, thank you for sharing that. That's ridiculous. And then some years later in my life, reflecting on that moment and recognizing that I could remove regret from my life if anytime I felt like I would regret something, I found what my lesson was in it. And it totally changed my life. So I could make mistakes, I could allow myself to make mistakes as long as those were learning lessons for me, and then I didn't regret that.
Yeah. Now, was there other lessons too? I mean, regret's probably a big tip that they all probably provide, is don't regret anything. Is there any other?
Oh, I mean, I think we have our typical adages about living every day like it's your last, taking time to truly appreciate what's around you, which we often don't do because we're so busy rushing through life. I have had a lot of advice about slowing down at work and taking time with my kids because they grow quickly, and I'm learning that, and you're going to be learning that.
I am learning it.
So, I mean, there's been a lot of sprinkled wisdom, but I think that episode with Manny is the one that comes back to me regularly throughout my life, that I can constantly be learning and improving.
Yeah, and I think the path that you've gone on is kind of where I'm at a little bit. Not saying I'm working with elderly people, but being in my 30s, a lot of my circle are 40s, 50s, 60s.
Yeah.
So I'm like the young guy, and it's like you're getting all that experience without really realizing it. And I think that's important for people to realize that you don't know anything. You don't know everything.
You don't know what you don't know, and there's a lot you don't know.
And just be quiet and listen and learn.
Yeah.
And, you know, Michael Pohl's another good example, my business partner. He's 20, going to be 21 here in the next few weeks. He's in the same circle. So he's got even another decade than I do to just learn and take it all in. And
Which is phenomenal.
in 20 years, I mean, he's going to be a genius.
Yeah, if he listens and learns,
yeah,
right? Yeah,
it's true.
Yeah, you have to take the time to listen and absorb the message.
The other thing I learned, and actually this was a good lesson last Thursday night at Rotary. Ken Turnage actually said the biggest lesson that he got was when a Rotarian asks you to do something, you just say yes. Now think about that in life. If people ask you to do something, don't find the excuse, just do it, and it makes kind of the circle go round. I mean, there's so many lessons out there if people just take a moment and think about it.
Yeah.
And it all comes from elderly people.
You just called Ken Turnage elderly. Awesome!
No.
He's probably younger than I am.
The person that gave him that advice
he got
probably got
else.
10, 15, 20 years on him.
Yeah.
So you just have to listen to the elderly.
Yeah.
They know what they're talking about.
It's true. They've been there, done that, right? We've heard that, like, been there, done that. They've been there, done that a lot more times than we have. And there's something to be learned. Totally.
What are some of the hardest things you've seen in this field?
Oh, well.
Aside from death, but
Yeah, I was going to say, it's death is really hard, but it's also, in our case, when somebody dies in our service, that's our victory because they didn't die in an institution.
Sure.
But I think what's really hard is watching folks struggle with losing the capacity to do things that they've done throughout their life. That's really hard. We're there to support. We're there to provide family and care and other opportunities, so we figure out what you can do instead of what you can't do and focusing on that. But it's still a loss, and it's a grieving for that person, and that's really hard to see.
But there are also some victories.
Lots of victories. We have.
What's your favorite victory?
One of my favorite, because I have a lot of favorite victories, but one of my favorite victories is from our CCT program. That's the California Community Transitions Program, and we run that actually out of the Bedford Center. And also we serve Solano County and Sacramento counties with this program, but we get people who have been long-term residents of skilled nursing facilities, and they want to go back to the community, and we find housing, we adapt it, we connect them to services, and we bust them out of jail. That's what we call it. And there was a woman. So when I started working at Mount Diablo Center in 2002, there was a woman there who was a participant, and she at one point got beaten by her caregiver into a coma. and ended up in a skilled nursing facility and was there for 5 years living with a seizure disorder and couldn't care for herself and couldn't get out of this skilled nursing facility, sharing a room, not independent. And when the state came to us, Department of Healthcare Services, and asked us to start providing this CCT program, the first referral that we got was this woman. And so I called her. I couldn't believe, like, I'm looking at the name and I'm like, it can't be, it can't be, it can't be. She answers the phone. And I said, hi, this is Debbie Toth. I'm calling from, and she goes, Debbie from Mount Diablo Center. I was like, oh my God, it is you. Oh my God. And within 2 months, she was in Stoneman Village in Pittsburgh in her own independent apartment. And guess what? That was in 2009. It's 2018. She's still there.
Nice.
Yeah. So at the time that we met her in 2009, again, her vision of what her life was going to be like was sharing a room in that skilled nursing facility for the rest of her life. That's victory. I mean, massive victory, right?
I think we should just stop there.
Yeah.
That's a positive. We're done.
No, we're not. We have to talk about how people can help us.
I was going there next. So how can people get involved?
So there are a whole host of ways that the community can support the work of our nonprofit organization and many other nonprofit organizations. Many of us rely heavily on volunteers. It is wonderful not to see my face every day, to have different people coming and interacting. Ask my husband, he'll repeat that. Having different faces come in is super important to folks. We also rely on people who have a background in accounting, who can provide some back office support or executive assisting or administrative assisting. So there are a lot of different, so people who retire in those fields come in and provide support in those areas. When we have fundraisers, like we're having our 43rd annual crab feed on Saturday night, it takes about 60 volunteers to make that event happen. So people who like to do one-off events for volunteer work, we take volunteers that way. We always take money. We always need money, and we always are the best spenders of the dollar. So we are extremely frugal with our money, and so when people donate, they know that they're investing in something that is financially sound and spends their money thoughtfully. So we always are looking for money, we're always looking for volunteers, and we're always looking for referrals and connections. So do you know a caregiver who's struggling and needs some support? We provide support groups in Pleasant Hill and in Antioch, and if those two places aren't right for you, we're going to connect you to somewhere where it is right for you. We want to help the community, so if you have needs, show up. If you think you know somebody whose our work is going to touch their heart, connect us to them.
Debbie, I want to thank you so much for taking the time to come out and talk about your organization, what you're doing, sharing how people could get involved. I think it's important that the community take a moment to really see how they could help you and propel kind of what you're trying to do, whether it's with you expanding it or growing other programs. I think it's a total need out here. So thank you so much for coming out. Mike Burkholder, Contra Costa Today. Please like, subscribe, follow us, and we will see you next time. Take care.